Are you a parent who feels like you tried everything to help your child, from diet changes to therapy to medications, but nothing seems to provide lasting relief? You're not alone. Today, an alarming 40% of children struggle with chronic health challenges, from digestive issues and respiratory problems to behavioral issues and developmental delays. While many doctors focus on caring for individual symptoms, there's a crucial piece of the puzzle that goes overlooked: your child's nervous system's regulation. This video is for parents who feel frustrated and helpless after trying countless approaches to help their struggling child, only to find temporary relief or no improvement at all. If you're tired of being told they'll grow out of it or being dismissed by healthcare providers, this information could be transformative for your family. We'll explore how a dysregulated nervous system could be the hidden root cause of your child's ongoing health challenges, and more importantly, how neurologically focused chiropractic care can help restore balance and unlock your child's natural healing potential. Henry's story, he actually came to us when he was 20 months old, and he had already been through 13 rounds of antibiotics for chronic ear infections and even had tubes placed in. His parents were stuck in a frustrating cycle of temporary fixes, knowing there had to be a better way to address the root cause of his struggles. Once Henry began chiropractic care, the changes were remarkable. While he still experienced an occasional ear infection, his body now responds naturally, and he even runs a fever to alert his parents rather than suffering in silence. Before care, his sinuses would get so congested that he'd just have swelling around his eyes. But now, with neurologically focused chiropractic care, it helps his body drain that mucus, helps his body function better. And they've had even bigger changes than they expected. His vocabulary exploded within a few weeks of started care. He went from speaking words to speaking full sentences before the age of 2. But the most life-changing shift has been Henry's asthma. Before chiropractic, asthma controlled his life. Frequent doctor visits, hospital trips, and the constant fear of wheezing and dangerously low oxygen levels. Mom was monitoring his oxygen levels each night with one of those little socks, anxiously checking to make sure that his breathing was okay. But since starting care, Henry has actually only used his inhaler one time. Before, he needed it multiple times a week. Henry's parents originally sought out chiropractic care for his ears, but what they gained was so much more than they ever imagined. So chiropractic care has been a huge help in Henry's body and allowing it to function on a neurological base, so he is more healthy and more resilient than ever before. And he's also given his parents so much peace of mind. So now let's break down nervous system dysregulation. So how your child's nervous system, it's their body's master control center. It's responsible for every function from digestion to emotional regulation. When the system becomes dysregulated, it gets stuck in what we call fight or flight mode, making it impossible for the body to rest, heal, and develop properly. This dysregulation can start as early as during your pregnancy, and it can continue through the birth and early childhood. However, this doesn't happen out of nowhere. There are factors that we refer to as the perfect storm that creates nervous system dysregulation. High maternal stress during pregnancy can alter a baby's developing nervous system. Birth interventions like C-sections, forceps, vacuum extraction can physically impact the delicate nervous system. Early childhood exposure to toxins, frequent illnesses, and antibiotics further stress their system. These factors combine to create what we call the perfect storm. The nervous system is just stuck in dysfunction. With this background of understanding, let's get into the signs to look out for that may indicate your child's nervous system is dysregulated. Physical symptoms can be sleep issues, digestive problems, frequent illness, Emotional challenges can be anxiety, mood swings, difficulty managing emotions. Behavioral issues can be trouble focusing, impulsivity, sensory actual sensitivities. Developmental concerns may be delays in meeting milestones, and coordination and motor problems. Taking in all these factors, let's explain why the traditional approach often falls short. Most treatments focus on managing symptoms rather than addressing the root cause. Medications may provide temporary relief, but they don't restore proper nervous system function. Even natural approaches like diet change, while helpful, don't fully address the underlying neurological imbalance. They just don't get to the full root cause. So if you're ready to discover whether nervous system dysregulation could be holding your child back from optimal health, we truly invite you to take the first step today. Our scanning that we use in our office is an objective measure that shows us your child's nervous system function, and it identifies these areas of dysregulation that might be contributing to their challenge. At Cultivate, we focus on helping children like Henry restore proper nervous system function through gentle, specific adjustments tailored to their unique needs. Please visit the link in our bio to schedule a consultation or insight scans for your child. You can also send us a DM with any questions that you have about how neurologically focused chiropractic care could help your family. Together, we can help your child break free from the cycle of chronic health challenges and unlock their full potential for healing and thriving. So we hope this finds you guys well, and we look forward to serving you and answering any of the questions that this video may have stimulated for your family.